So the question of the day for the panelists was, do the public communications to persons and to clinicians, do they meet your needs? Do they help you? Have they helped you? And it feels to me like that question is almost unequal to the larger question that the issue of cows and food contamination raises. But that is the first question of the day, and I'm sure that there will be other questions to follow up. So for the panelists, what is your feeling about the public communications that you can see to either yourself from federal agencies or state agencies, and or to clinicians from federal agencies or from any organization about PFAS?
My comment is, when my state found out about it, the CDC called me up, and we talked to them about it. We reached out to them, and the only advice they gave me was, well, you just need to drink more water, just start drinking bottled water, quit drinking your well water. And I'm like, well, yeah, that's pretty simple. I'm not really impressed with what I'm seeing locally at the state level. And I do see a lot of the stuff that's on the internet that we looked up, and there's some pretty good information there, but the CDC did not have. And then we even talked to some folks down in that, they had a big meeting here in Clovis, and I forget that, well, they were from the Georgia area, and I forget who they were, but they're really naive in all this PFAS thing. And I think that, I don't know if that's causing why the EPA and the FDA are not setting standards, but I think a lot of people are really naive about PFAS.
Thank you. Any other panelists with thoughts about that? Excuse me, any other presenters with thoughts about that before we go to the panelists?
I mean, I'll be honest with you. I've been working on this issue for 2 to 3 years, and I still don't know what a good PFAS score is in human blood or a bad one. And I still don't know what a person would do medically other than try to address the specific diagnosis that it's related to. So as he's got a 28, I don't know if that's high or low or extreme. Or there was a nice lady from Wisconsin, I believe, and she had a number that was in another stratosphere, as I recall. I don't think there's any public education on that. And as far as to me, there's a challenge where individual states are developing their own numbers about what's safe for water. Instead of 70 parts per trillion, that some states have 12 or 6. And that's kind of a contest, or a race, which is interesting. It's not all that productive. I think that we would be better off if there was a focused effort on realizing, because the LHA number is going to become the permanent number at the federal level. I don't believe it's going to be modified, the lifetime health advisory number. And we need to focus on what is a consistent number. It doesn't do any good for doctors in Michigan to say that the best blood pressure is 110 over 72.5, and doctors in Massachusetts say 120 over 80 is great. It's better to have a common message that can be shared broadly throughout the profession. And so both in the water numbers and in the blood serum scores, I think an effort should be made towards standardizing it and then realizing what does that mean. I don't think the public has any idea about that.
Okay. Nikki Heineck, have you seen any? Have you had any experience with any of the public communications from CDC was mentioned, or anybody else that you would like to comment on?
I have not. I reached out to some of them, specifically the Iowa DNR. And again, I don't know if it's just so new in Iowa that nobody had any type of insight or were really even acknowledging PFAS contamination in the state.
Okay. All right. Thank you for that. I think it's time to turn over the session to the panelists for any questions that they might have.
It looks like you have one from Chris.
Okay. Go. Oh, yeah, there it is. Okay, I just saw it. Chris, please go ahead.
Thank you. Mr. Scott, thanks for your presentation. And I also wanted to acknowledge the integrity of so many independent farmers like you that do the right thing because it's the right thing. And it's really commendable that you've responded like you have. Unfortunately, I'm not sure the agencies you've been working with have responded in kind. I'm curious if there are any lessons to learn from the agriculture industry. They apparently have told you levels beyond which your milk had to be dumped. They've told you levels at which your cattle had no longer had any value. What kind of rationale was provided, or what kind of information, data? What was the story that you were told to support that, so that you had some sense of why it was that they said at this level your cattle are no longer viable?
That's a great question. They had no backing up. They had no, they just said the state pulled my grade A permit. And they got that number from the FDA, the 400 parts per trillion. And I'm not sure why it was that number. But they pulled my grade A permit, and I think that would be something that we probably need to follow up on.
Yeah. Can I interject?
Part of our lawsuit. Yeah, go ahead, John.
Mr. Wyatt, we had that question, and we conducted a series of Freedom of Information Act requests to the FDA, the EPA, USDA, FSIS, all these alphabet soups. And what they came back with was basically a straight adoption of the EPA testing standard for the presence of PFAS and in those concentrations. So they simply made what looks to me like a correlation change. In other words, if the human diet has a liter of water per day, and that's at 70 parts per trillion, they simply said, okay, the human diet, or the American diet, has a deciliter of milk per day. So it would be 10 times that number. They quantified the consumption in the normal diet with the gradation. And then that's for liquids. And as for solids, it looks like they have adopted measurements that reflect what in solids. I'm talking about beef now, okay? They're looking at the blood serum, and not the meat itself, but the blood in the meat, not the tissue per se. And they're looking at that as a basis for these calculations. But, it took some effort to find that. As far as the public presentation of these numbers, these were just adopted. And this is the challenge we have with interagency misdirection and lack of communication. We would be very well served to have a seminar like this on the topic of setting standards across the board for the diet of Americans and what is safe and what is not, taking into consideration lots of different types of foodstuffs and raw commodities.
Okay, thank you. It's helpful.
Okay. I don't see any other hand raised at this point. Are there other questions?
Kevin Elliott, I think, raised his hand.
Oh, okay. That's not coming across on my screen. Please, if somebody else can see all the hands raised, please, somebody from the NAS side, please just call on folks, because I'm not seeing the hands raised.
Can do that.
Thanks. Again, I just want to echo, I think we're all really impressed with your integrity, Mr. Scott. You mentioned that there was this program, I think you said it was the Dairy Indemnity Program, and that maybe that helped until last December or something along those lines. I was just curious how, what has enabled you to keep going since then? What other programs are available? It seems like it's going to be a real problem to get, farmers and those in agriculture to, all be as responsible as you are if there aren't adequate programs available. And so I was just wondering, what resources are there for helping folks like you?
Well, John was involved, and the dairy indemnity program was designed for contamination in milk, and it was designed for like, let's say someone put something in your milk tank, or the cows ate something that got into the milk. It was designed for short-term problems. And when I had this PFAS, John, correct me if I'm wrong, but they basically, through the ag department, basically did a in-house change for me to be accepted in the opportunity to get paid for the dumped milk. And so I got about 75% of the value of what the milk I was dumping. And then also they, in that program, and through the senators and representatives, they passed a bill that has to where you can use that dairy indemnity program to buy the cows too if they're infected with this PFAS. And now that we're finding out that it's not just leaves fast, so that's what we're trying to get the USDA to implement that program. There's also other programs out there, like if cattle get poisoned on different things, there's livestock indemnity program out there. What was that, John? What was that one?
The tuberculosis.
There's one for TB, and then there's one for if they get poisoned by other products and get into the animals, then they would dump them. I mean, be able to not dump them, but be able to compensate the farmer for those. So, I mean, we're working with, John, could you explain to them the 3 different ones that we're working on right now with the USDA?
Well, it's a little bit off topic, but I certainly appreciate the question. It's the entire nationwide budget for this dairy indemnity program was $500,000 before Mr. Scott came along. The cost of feeding 5,000 animals at $3 a day, that's $450,000 a month right there. So we were working with the new Secretary of Agriculture, Secretary Vilsack, and he has testified before Congress that they know this issue is out there. There's this internecine fighting between the DOD, the USDA, who's responsible. No one, as Art suggested, no one wants to take responsibility. So it's challenging, particularly in these times when you can't march up to Capitol Hill and stomp your foot, outside the door of your congressman or senator. But we're doing what we can. There are state sponsored COVID relief bill measures that we've tried to take advantage of to protect the Mr. Scott's enterprise. And there are federal PPP loans and things like that that folks might be familiar with, but that it doesn't approach the scale of the problem. He spent 30 years building this dairy up, and it was taken down overnight. And so to try to hang on to it and protect his holdings, his family's future, and do the right thing, as you say, it's been a phenomenal challenge. And I'm educated as a policy person, and Art he's been right there through this, very attentive, very upbeat, optimistic, and we're hoping for a solution that doesn't end up in the bankruptcy courts with some judge deciding what to do with all these cows. That would be a further environmental problem. Even dumping the cows into the soil, if you if they were to be euthanized all at once, you're creating a Superfund site in and of itself, essentially, by dumping 5,000 carcasses in one location. So it's a challenge, and we very much appreciate the empathy expressed today and all your support. Thank you.
We have just a few seconds left. Are there any closing comments?
Yeah, or Alan, if I could. Hi, this is Erin Haynes. I thank you. This is just a tragic stories, and I guess I'm glad you appreciate our empathy. But what can we, if you had one request from this panel, what would that be? What would you like to see come out of this?
EPA standards, FDA standards, so we can put teeth in the law, because I think that's the biggest. Everybody has the same problem in this whole thing, and without that, I mean, the Air Force is like, well, yeah, you know, we would help you, but there's no EPA standard or FDA standard, and I think everybody's got the same problem, and that's what we need to push for and get press the EPA director to finish the job that didn't get finished with the previous administration.
Well, I would just say that the CERCLA, the Superfund solution is not an absolute. It's a 25, 30-year solution, if you will, of cleanup. It doesn't start to go to health. We've advocated for the establishment of really a fund, something like a community development block grant fund that communities can tap into. Maybe that's something that is available both to address community health issues as well as real property devaluations. As you can imagine, if you have a home with PFAS in the soil, or a farm in this case, it's virtually worthless. You can't put that on the market and resell it. And to say to someone, well, okay, under Superfund, you as the homeowner are also liable for the cleanup if that's not done by another party, that house basically comes off the market. And it's something that must be addressed in a comprehensive federal way. And we're looking for leaders in Congress to take up the mantle of doing that. You know, after 9/11, there was a fund, and that was in the news some time ago about restitution fund, both health and property. After in the wake of the tobacco litigation, there was a fund established, and Congress was right there in the middle of that, watching that come together so that local states could tap into those resources and move their economies along away from tobacco production and so on, and dealing with medical costs as well. So those are comprehensive solutions, and we're looking for those, and we would like to be involved in those leadership conversations. And this panel has been great today because you've had all the folks around the country who are dealing with these issues, and we probably should get together and work together and focus our efforts on a federal solution. Today we don't have it.
Thank you. Thanks to all the panelists, and certainly to our presenters today, and for the opportunity to be part of this. And now I'm going to turn the microphone back to NAS.
Thanks, Dr. Dicketman. And I also want to thank Nikki, John, and Art. It was a terrific panel among terrific panels. And I appreciate you stepping up, taking on the issue of public speaking, which is no one's favorite thing to do, and doing it so well, and providing us good stories and some additional perspective to think about in terms of impact on the agricultural community. It's just very helpful. We are going to take a 5-minute break and reconvene at 20 minutes after the hour for our final session today, which is an open comment period. And so we'll see everyone back in about 5 minutes. Thank you.